endoscopy during COVID-19? And what can we do? And you already heard we want to discuss about opportunity of transnasal endoscopy, but also what we want to do is we want to share some new development of Fujifilm for you, what is specifically developed to reduce droplet spread during endoscopy procedures. So again, hi, I'm Helmut Neumann from Germany, and thanks so much for taking your time in this Friday afternoon with us. So COVID-19, of course, what we all know, it has a massive impact on endoscopy procedures. So in all our countries, we have dramatically reduced endoscopy procedures. For myself, at the university hospital, for example, we have reduced endoscopy procedures for more than 60%. So mostly doing only emergency cases or cases of patients where we schedule them for surgery or something else, but all more or less routine endoscopies have been cancelled. So this is, of course, a major impact for all of us. And also, what we also all know is that we have specific challenges during this COVID-19 pandemic. And I would say it's two specific challenges. The first one is that we are afraid of getting infected. So the medical doctor and also our assistants, because potentially endoscopy, both upper and lower endoscopy, are high-risk procedures because the virus can be transmitted via aerosols and stool as well. But of course, also what we have learned is that our patients are afraid, of course, as well. And this is two specific challenges that we have to address. So the literature suggests a very low risk for patients, doctors, and nurses to become infected during endoscopy procedures. We have the data available, for example, from the Milan group. However, I would say this is just literature. So this is just science, but the personal feeling and the personal behavior, what we are learning, this is really different. And this can at the moment not be influenced by the study results, because we all have young patients in our intensive care unit suffering from the virus, and therefore we are all afraid not to become infected. So the question for us is, what can we now do in order to gain trust, again, in endoscopy procedures, but also what can we do to better protect ourselves? And I would say very important that we should now address this fear of becoming infected with modern and newer ideas and solutions. And this is what I want to show with you and what we want to discuss now together as well. So very important is doctors, nurses, and patients, they are afraid of the infection according to the aerosol transmission. So the question is, what can we do? And my answer is, let's reduce it. And the first one is that we maybe should not only perform peroral endoscopic gastrostomy, but maybe better to do it transnasal. And transnasal endoscopy is something what is very established in Asian countries, for example, in Japan. It's popular in France as well. It's popular in UK, but honestly, it's not that popular in general in Europe. And to the best of our knowledge, no one has thought of the potential of transnasal endoscopy specifically during this COVID-19 pandemic. Very important for us that if you look at the transnasal endoscopy from Fujifilm, it's a so-called EG740N. It's an ultra-slim type scope, and it has a very big field of view of greater than 140 degrees. The distal end diameter is only less than 6 millimeters in diameter, 5.8. The working channel is extremely large with 2.4 millimeter in diameter, and the total length of the scope is comparable to a normal standard gastroscope as well. It's 1.4 meters. You can see we have very good tip deflection here, 210, yeah, and 90 degree up and down, left and right, 100. And this is very important for us because all studies in the literature suggest that with transnasal endoscopy, we are not able to do the retroflexion that well, but I will show you later one procedure what we have performed yesterday specifically for you in order to show how this procedure works, and I think even how easy it is to apply. So very important with this ultra slim endoscope, we have a multi-LED light technology. So we have the fantastic LED light technology of Fujifilm. We have the super CCD chip. We have both chromoendoscopy modes included, link color imaging as well as blue light imaging, and also, of course, the one-step connector. So image quality is very similar to standard gastroscopes with transnasal endoscopy. So if you're afraid that maybe with transnasal endoscopes you will not have the best view, then I can say, no, this is not the case. You have a very good view even here with transnasal endoscopy. The working channel is large enough for taking routine biopsies. Some groups even are using transnasal endoscopy for peroral endoscopic myotomy or even for endoscopic submucosal dissection procedure. But at least for routine diagnostic procedures, I can tell you the working channel of 2.4 millimeters is large enough. And also what is very important, there is no need for sedative drugs and the patient wear face mask. So I may ask some of the participants who may not have yet switched the microphone off to do it, because otherwise we will have a little bit of disturbance. Otherwise, I will do it for you. That's not a problem. So perfect. I've switched this off and this one as well. So then we have a little bit more quietness. Perfect. So we have no need for sedative drugs and the patient can wear the face mask during the endoscopy procedures, I feel what is very important as well. So what are we now learning from the studies? Is transnasal endoscopy successful or not? And only to make it very short, technical success rates in the literature is very high, in between 90 to 99%. Very important, there is a learning curve of performing transnasal endoscopy. Diagnostic success rate is comparable to standard traditional peroral EGD. And also, if you look at the safety profile of transnasal endoscopy, it's really a very safe and well-tolerated procedure. Most common adverse event is epistaxis, which is approximately occurring in the literature in between 0 to 20%. So in the Japanese studies, we have only a risk of approximately 5%. In the English literature, we have a reported risk of up to 22%. I think this is according even to the learning curve. Again, in Japan, transnasal endoscopy is performed on a routine basis. Most important, epistaxis is normally mild, so there is no need to treat the patients for this. And in the literature, we have only one case of a perforation after transnasal endoscopy, but the perforation occurred in the esophagus, and the intubation of the patient was done without any problems, but the perforation occurred later because of massive coughing of the patient during the procedure. And the authors suggested that this massive coughing in an inflamed esophagus may have caused a very small perforation. So the question is now, how do I do it? What can I share with you? What experience? And maybe first of all, because we're all doing endoscopy, but mostly we're doing it from the transoral approach. So this is normally the approach we're going here, down the tongue, and then we have here the soft palate, and then we're entering into the esophagus. Very important, now we're taking a different road through the nose. And very important, if you're doing your normal peroral gastroscopy, we all know this caused the gagging reflex. It's very exciting that today with transnasal endoscopy, the patient potentially can even sing. So we always ask the patient to sing because we never had a patient who is singing, but the patients are regularly talking to us. So today we had the fantastic great luck to have two colleagues from Fujifilm with us doing some procedures in the early morning. So I think we have done 5 procedures in the first 70 minutes of the early day. And we had also done 2 transnasal endoscopies. And even the colleagues were very amused that the patient was able to talk with us during the procedure because, again, we are not entering through the mouth, but we are entering through the nose. So very important to have a look at the anatomy again. So peroral approach and then transnasal approach. We're going here through the nose and then we're going behind the epiglottis, as you can see, by entering here into the esophagus. And we are all clinicians, and I feel a video is a little bit better. So you can see here is the nose of the patient. And first of all, the question is, what is the best position? honestly, and this is something what we can discuss, you can do it nearly in every position. So the patient can sit, potentially the patient can stand. What we are doing, the patient can lay on the back or even in the left lateral position, like for normal endoscopy procedures as well. So we're mostly doing in the left lateral position because this is a position what the nurse knows what to do, and all machines in the right connection as well. But you can see here is the opening of the nose of the patient, and then you're just carefully entering with a scope here. And maybe some of you are now seeing for the first time here the entering of the nose. So very important, sometimes you feel a little bit of resistance. So the resistance is something what you can carefully approach with the instrument, and then you can see how relatively easy it is that you're now here already in this part, what we already know with the epiglottis. And then you can see the vocal folds here and the recessus on the right and on the left side. And then you can enter in the esophagus like with normal standard gastroscopy again. And then you're already here in the esophagus. And then you can do your examination. I just want to go back to show you the withdrawal of the instrument again from the esophagus. Afterwards, I will show you a total procedure of transnasal endoscopy from a routine case. And here you can see you are leaving again the esophagus. And now we are very carefully withdrawing the instrument so that you can see the anatomy again of the nose. So here is the upper esophageal sphincter. And then please note that you're carefully going back. Again, you can see the vocal folds, the epiglottis, and you can see there is no gag reflex of the patient. The patient has no sedation. Yeah, and then carefully you're going back here. And then again, you can see here, now you're again in the nose of the patient. And now you can imagine that epistaxis is the side effect sometimes what may occur. I would always recommend to use some good material in order that the scope is very floppy and goes very nicely inside. And then you can see here the way back out of the nose, and then the procedure is finished. But I want to show one case from the beginning to the end so that you can really see how one is doing transnasal endoscopy, and then you can judge if it's comparable maybe for you personal to transoral gastroscopy as well. So again, it's a new patient, it's a new case, and you can see here again the opening of the nose, and then we just start the procedure, and you can see this is now real time. There is no footage. I just want to show you how the procedure works. Again, you can see the entrance very similar in the previous case. Again, now we are entering here in the throat. You can see here is the recessus. You're already entering into the esophagus. And then mostly what you have to do is you have to clean the lens in a very good manner, because sometimes the nose is not that clean of our patients. Yeah, and therefore I would always recommend to take a little bit of time to clean again the lens of the endoscope, and afterwards you will have a very nice view again, and then you can perform very nice endoscopic procedures. So you can see we are now stopping here in the esophagus, cleaning the lens in order to remove everything what was inside the nose. And then carefully, now you can see we have an excellent image quality again. And again, with a transnasal scope, it's a fantastic image quality here. You can see the scope, yeah, you can see the size of the working channel here, 2.4 millimeters, and you can see the direction, as always with the Fujifilm scopes, of the working channel as well, so you know where your endoscopic equipment is leaving the working channel. So again, this is a normal case. The patient is not sedated. The patient is wearing a face mask. Yeah, and the patient at the moment not, but later on, she's also talking to us. At the beginning, the patients, when they have done the procedure for the first time, they are not aware that they are really able to talk. You can see the excellent resolution here. You can see the palisade veins highlighted now by LCI. You can switch to BLI as well to have a more closer look to the squamocolumnar junction here, and very nice even to see the difference now of the squamous epithelium of the esophagus and then the stomach epithelium here. Again, this is a live case. It's a normal routine gastroscopy here of this patient who was referred for chronic abdominal pain and resistant of H. pylori gastritis, so multiple antibiotic therapies were not working in that case. So again, unaltered video footage here. So this is the normal case. So you can see, meanwhile, we have already inflated air into the esophagus. Yeah, and therefore the stomach is already bloated a little bit with air. You can see the antrum here and the pylorus. Sometimes what we all know, the pylorus is very close. It's not that easy sometimes to enter with a normal endoscope. Of course, in general, it's always possible. If you're asking transnasal endoscopes, is it easier to enter that pylorus or not? So in general, yes, but the instrument, of course, is not that thick. So it's a little bit more floppy. So sometimes, even though the instrument is very slim, you need to pass a little bit of couple of times in the antrum in order to go there. Now we have already reached the deeper part of the duodenum. We take the picture of this one, and then you can see the resolution of this scope. And again, finally, you can come back. Again, I want to show you the whole procedure. We are all doing a lot of procedures every day, but this is, again, the procedure during transnasal endoscopy. What you cannot hear is that the patient is now already talking to ourselves. And also you can see now the retroflexion here of the scope. Yeah, and you can see even retroflexion is very easy and also very effective, and I would say the same effective like with standard peroral gastroscopy as well. So you can see a small hiatal hernia here in this patient, and the cardia is not completely closed. So now the next step, of course, would be to take some biopsies, and also there are specific biopsies which are specifically for these transnasal endoscopes, because you have to be aware, although you're using a 2.4 millimeter working channel, this size is a little bit smaller than the size of the normal, is a little bit smaller than the size of the normal working channels, which is greater than 3 millimeter in diameter. Yeah, so do not use, please, your normal snare, but specifically use this one for transnasal endoscopy. And then you can see the first biopsy, and again, a normal procedure here, which is highlighted, and we are already here at 4 minutes and 40 seconds. So we're always taking 2 biopsies from the antrum. We're always taking 2 biopsies from the corpus. Yeah, that's the second biopsy, and then you can withdraw it. And maybe you agree now when we're looking at this procedure. Again, it's a real life procedure because I feel this is the best to show you how transnasal endoscopy is working, to show a whole procedure, and then you can identify by yourself if you agree with me or not. But I would say there is really not a difference compared to peroral gastroscopy. And today we had a very great luck to receive a 4K monitor for our video processor of Fujifilm. And using the 4K monitor and transnasal endoscopy, well, honestly, this is a super CCD optic, but with the upscaling of the 4K monitor, we all agree that this was already an image like for sorry, I switched it here, like with a CCD optic. Yeah, so this is now this biopsy of the stomach, of the corpus, and then we are already going a little bit back here by entering again here into the esophagus. And then carefully going back. And I already found the one who has not switched the mic off. Yeah, and then you can see here again the regular epithelium of the esophagus, and then the total procedure is finished in a couple of seconds. And I feel this is a huge potential here. You can see the recessos, you can see the vocal folds. Now we are asking the patient to say ah. So you can see the reaction, here of the vocal folds, and then you're withdrawing the instrument and everything is finished. So what we have done, and a colleague who is also participating, and I'm very happy that you're with us, was asking me if we're doing a study and he is interested to participate, and maybe we can discuss about this later on as well. So what we have already done is a study on transnasal endoscopy during the COVID-19 pandemic as a safe and feasible alternative. The idea again was that COVID can be transmitted via aerolized viral particles, and that EGD is considered by most societies as a high-risk procedure, and therefore we thought about transnasal endoscopy. Again, we have started already at the first wave. And what we have done is we have developed a specific questionnaire to assess patients, physicians, and nurses' choice of method, the psychological aspect, the preference for a method to future examinations, the tolerability and the safety as well. In addition, we have performed biopsies in all the cases or other endoscopic interventional procedures, and we have sent them to pathology. The pathologist was totally blinded, so we have sent biopsies via the peroral route and transnasal as well. The pathologist was totally blinded, but the pathologists always need to count the size of the biopsy. So we also assess sedation and also the time in the recovery room, again, during the COVID-19 pandemic. So in general, we have included now over 442 patients, and the interim analysis of those results is something what I want to share with you, because this is pretty new. And the data are now in preparation, of course, for publication. And maybe this is something what one can do even in the future together. So technical success rate in this large study was now 97%, diagnostic success rate 100%. So in all the cases where it was technically possible to intubate, even the diagnostic success rate was there. So in the 3% where it was not possible to intubate the patient via the nose, it was possible to do the procedure via the mouth of the patient, but with the ultra-slim scope. So it was not necessary to change the endoscopic equipment. So if you're looking for satisfaction rates, it was rated as highest in 95, 97, and 94% of cases for the physicians, nurses, and for the patients. The sense of security. So the question was, do you feel more safe in doing transnasal endoscopy compared to peroral gastroscopy? And this is something what we have asked, because most of the patient already had gastroscopy before, but you can see the physicians love transnasal endoscopy, the nurses as well, but even most of the patients feel more safe with transnasal endoscopy compared to peroral gastroscopy. And then sedation was required in our study in 40% of cases. Mostly we have used propofol sedation, and but 52% of our patients were directly discharged home after the endoscopic procedure. And I feel this is a very exciting data for us, specifically during the COVID-19 pandemic. 90% of patients would prefer transnasal endoscopy as a first choice for the next procedure, because we have asked all of our patients after the procedure, what would you choose next time, transnasal endoscopy or even maybe better peroral gastroscopy? But you can see 90% of the patients said, no, next time, please, again, transnasal endoscopy. In our study group, 8% of patients experienced epistaxis, but it was always mild and stopped a couple of minutes at least after the procedure, and no additional complications were assessed in this study, again, including more than 440 patients. So in general, I would say transnasal endoscopy indeed was very safe. It was well tolerated, associated with a very high level of patients, physicians, and nurses satisfaction as well. So you can see that most of the procedures were done without sedation, what was resulting in a very short recovery times. Also, we, of course, needed less staff members because it was not necessary to sedate the patient in most cases. And also the procedure, as you have seen, was very fast, and therefore the exposure time was relatively low in a potentially higher risk environment. So my idea would be, but this is something what we of course can discuss, but my idea would be indeed that transnasal endoscopy definitely is a very good opportunity for us during these challenging times. And I would always consider it at the moment as a first-line diagnostic option for patients requiring EGD. So again, I promise to you that we have something new, even from Fujifilm for you. This is not only transnasal endoscopy, but we want to reduce potential aerosol transmission. And in this specific setting, there is now the availability of a new so-called droplet reduction mouthpiece. So we all know the face mask, what we are mostly wearing during endoscopy procedures, but you can see that there is now a new one specifically developed from Fujifilm, allowing us to perform peroral gastroscopy with this specific face shield of the patient. And you can see that there is a sponge in between, allowing for safe introduction of the endoscope into the mouth of the patient. And even if the patient is coughing or anything else, we have this droplet reduction here in order to better protect ourselves. So the droplet reduction mouthpiece, you can see the insertion portion here is possible for all intubation tubes from 3 to 16 millimeter. So you can use it with all your normal gastroscopes without any problems. So the drape has a size of 30 to 30 centimeter. And also what you can see, if you want, you can place the upper part downwards, as you can see here. So even this is then possible. So very important is this wing structure here on the side of the drape as a fixing part, like for a normal mouthpiece as well. And then also you have the advantage that there is enough space here in between the face shield and the nose of the patient as well. So this is also, I feel, very important for us. And I will show you later on some ideas and results as well. But first of all, I want to share again with you a procedure from our center, because we're using now the mouthpiece for a couple of weeks, and we're also doing already a preliminary study assessing mostly the safety profile of this face mask, because what we are doing is we are measuring all the vital parameters of the patient, including even CO2, because of course when the patient is wearing such a mask, one might argue that there is a lot of CO2 maybe coming back, so every patient is receiving capnometry in our procedures as well. And so far we have already done more than 100 with this specific mouth guard, but very important that there was no drop in the O2 saturation, and even the CO2 was not changed in any way in the patient in our prospective study. So you can see this is now the procedure. You can see the face mask here. You can see the introduction line. And this is now recorded with the endoscope. So you can see the way of the endoscope inside the mouthpiece. And this is the sponge which is open. Now you're in the mouth. And I would say what is very exciting, and this is something what is extremely exciting also for me doing a lot of therapeutic procedures, this mouthpiece is so much stabilizing the endoscope. So I would love to use it even for therapeutic procedures. So far, I've done one ESD in the stomach with this mouth guard, and with a personal feeling, I would say indeed the scope was extremely stable. But you can see it here. So it's fixed in this sponge. You can see it's not moving anywhere. Yeah, and then you can carefully advance the scope. And now again, you can see the difference to transnasal endoscopy. Yeah, with transnasal endoscopy, we would choose the other route, and then the image looks again very much the same. And then you can carefully intubate here into the esophagus, and also you can go here and do the additional examination of the procedure. But this is the specific mouth guard. So very important now to have a look how it looks from outside, and then you can see this is the mouthpiece, and then it's just inserted, and this is all what you need to do. And here, by the way, you can see the CO2 measurement of the patient as well. And also I want to show you at least yeah, this is what I wanted to show you. And then finally, I would say, before we are going into the discussion, and hopefully you're interested to discuss with me as well. So I would say COVID definitely will stay with us in the next month. Definitely we have to overcome the current challenges in endoscopy during this COVID-19 pandemic. I would say transnasal endoscopy, what I've shown to you, is definitely a new, smart and feasible approach, and could be definitely considered as a first-line option for EGD when it's possible. When it's not possible, I would say the new personal protective equipment of Fujifilm. I've shown you the specific mouth guard, what is very easy to use. It's placed in a couple of seconds, but this yields an immediate reduction of droplets during endoscopy procedures as well. And I just want to close this, this presentation with very important two words, and thank Fujifilm very much again for bringing us all together to discuss about these options, because we want to make endoscopy more safe and we should never stop in doing this. Thank you very much.